Go to the pediatric ward of a hospital in many African countries, and a large percentage of the children there are likely to have malaria. Here in Western Kenya, it accounts for about 1 in 3 deaths of those under 5 years old. And the misery extends to those who survive. Many of the children are sickened with malaria repeatedly, sometimes 3 or 4 times every year. That's tough, not just for the child, but also the parents and guardians who must look after them. Here in Africa, the standard treatment for the most deadly strain of malaria, Plasmodium falciparum, used to be chloroquine. But over time, the parasites adapted and became resistant, rendering the drug ineffective. This left scientists, like those at the US-based Centers for Disease Control and Prevention, in a bind.
We lost chloroquine in the most malarious part of the world, Africa, over a period of about 10 years. And we went through a very difficult period in malaria control after that because of the loss of chloroquine.
The next medication suffered the same fate. But there was something strange about the parasite's behavior. The mutations that caused the resistance did not take place in Africa, where the vast majority of malaria cases exist. They began here, far away in a remote part of Western Cambodia. Over time, the resistance spread from here to Africa, where it did the most damage. Now, the best antimalarials are called ACTs, combination therapies based on the compound artemisinin. ACTs are the current gold standard for antimalarials, but as good as they are, there's a crack in the armor. There are signs that the parasites here are adapting again. We sent a crew to the area in 2009, when evidence of ACT resistance was mounting. Dr. Mark Fakuda was one of the scientists leading a research team here. This local teacher is typical of the findings. Like at least a third of the patients in Fakuda's study, he's still positive for malaria after 4 days of treatment. It may not sound like much, but it is significant.
And whereas one would expect parasites to clear in perhaps 2 days, 48 hours or so, in Africa, in what we're noticing here in this site particularly, is that the mean time for parasite clearance is between 60 and 65 hours. We're concerned that this is a harbinger for early resistance that might later translate into the drugs being ineffective to achieve a cure. Good.
It's unclear why this part of Cambodia seems to breed resistance, but the local market provides clues. Pharmacists can be found selling substandard or counterfeit drugs, or partial doses of approved medications. Inadequate treatment like this often kills weaker parasites, but the strong ones survive and can develop resistance. The Cambodian government is trying to combat this by banning monotherapies, single drugs that are easy for parasites to fight. The government has also conducted mass screenings in the area and trained at least 1 volunteer in each village to conduct free malaria tests for anyone with a fever. But even if those strategies succeed in Asia, the recipe for disaster still exists in Africa. People here, like in Asia, sometimes fail to take the full dose of antimalarials. Counterfeit drugs are also a problem. The CDC, which is conducting several studies in Africa, says governments must ensure people are getting the right medications.
What needs to be done in Africa currently is we really need to monitor for drug resistance, but at the same time, use of and access to good quality ACTs. I mean, I cannot stress the importance of that. And I don't think all countries in Africa really have succeeded in doing that.
If they fail and resistance becomes widespread, malaria victims could be left defenseless.
Unfortunately, there are no drugs on the market or waiting to be introduced that can replace these ACTs. The next class of malaria drugs are probably at least 10 years away. So we are relying very heavily on these ACTs for the next decade or so to keep us with an effective therapy for malaria.
Indeed, the World Health Organization has said that if ACTs lose their effectiveness, the results would be catastrophic. This with a disease that already kills one person every 45 seconds. Gary Stryker, Global Health Frontline News,